Shall we start? Omar? Can I talk to Omar, please? Shall we start? Not. Say yes, say no. Who is saying yes? Is Umar with us? No, okay. Okay. Everyone says yes. Then I can't say no. Okay. Everyone says yes. Can I say no? Do I have option? I'll give you options. When I ask you certain questions, I'll give you options. And I don't know whether you know my options or not. Okay. Now let's start with the face and the scalp. Beauty.
I like this guy. I like this guy. I'm watching this lecture.
Omar, would you mind to, mute yourself, please. Now these are the main objectives. So we need to understand the main muscle of the face, innervation and their clinical feature if there is a loss of innervation, and layers of the scalp and their clinical correlates, blood supply, face, scalp and the venous communication for the importance for the clinical correlates. Okay. I put my own picture there. Could you see that? Do I look the same? Do I look the same? All right. Okay. I thought I'm now looking younger than this one. Anyways. What is the significance of the face? Are you a model doctor? I am a role model doctor. I'm not a model. My wife says, don't tell her, but she says, if I were not a teacher, I would have been an actor. For to be an actor, you need to have certain traits. Modeling is one of those. Yeah, but I'm not a model. Okay. Anyways, I do have a look actually. But I'm not a model. Okay. You made my day actually. We'll continue. Shapes, identity, face is for identity. How do we identify? Based on the shapes of the bones, color of the skin and texture, any marks of the moles, spread of hair, many or lack of hair, facial expression. What is the importance of the face? Is it for the oral communication and expression? That is a very lovely universal expressions. Surprise, fear, disgust, contempt, anger, sadness, happiness. You must have seen those emojis. Have you seen those emojis? Tell me which part of the emojis are, if changed, will change the expression. The mouth. Most of these are mouth. Some of them are eyes. Even are less than are eyebrows and eyes. Very little combination of all these. So it's just the mouth only. Now you can see what are we changing here. Expression. Neuroexam reaction. Which one is that? Tell me. Which one is that neuro reaction? Which one among these? Disgust. The last one. The sadness. Goodness. I love it. I love it. Disgust is a disappointment, isn't it? The other name for the disgust is disappointment. Contempt is a disappointment. Confusion. If the confusion is at the beginning, it's good. And if the confusion is towards the end, then it's a trouble. Anyway, we will continue. Sorry. Sometimes. Okay. Now the surface anatomy of the face. Yeah, different features that you need to understand. You don't need to like be an expert, but you need to understand, because we will then relate with different things. We have, you remember that we talked about different regions. Now this is a frontal region. These are the superciliary arches with the eyebrows. We have the superior palpebrae, inferior palpebrae, and the gap in between the two. The eyes that you see is basically the gap between upper lid and the lower lid. We call it the palpebral fissure. This is the bridge of the nose. This is the dorsum of the nose, the tip of the nose, the ala, and the nostrils. The upper lip, the lower lip, and this is the palpebral fissure there, and this is the labial fissure, which is between the lips. Okay, that makes sense. This depression between the two, right and the left half of the upper lip, is called the philtrum. That makes sense. Finally, we have the chin. These are the different regions of remember we talked about these regions. Now we look at the different regions of the face. Okay, so we have the orbital region, we have the infraorbital region, we have the buccal region, we have zygomatic region, which is this cheekbone area there, we have parotid region there, we have oral region around the lips or orbital fissure, and a mental region, which is the chin. So these are the different regions of the face. So remember that we have regions of the face and the head. Now if you look at I would love it to continue, but we don't have much luxury of the time. Okay, now if you look at these different regions from the side view: auricular, orbital, nasal, oral, buccal, and mental regions of the face. Why are we interested in knowing that? Because there are underlying muscles sitting, underlying vessels sitting, underlying nerves sitting. Hence it will be easy for us to name and know these. Okay, beauty. But aesthetic regions, if you go to a beauty parlor, these are the areas that people will put different makeups. So around the eyes would be a different blush on, around the cheek will be a different base and different makeup on that. Around the eyes will be a different liner, around the lips would be a different liner. So these are all the different aesthetic units. Among these aesthetic units, if you see, because they have been exposed to the ultraviolet, the distribution of the carcinoma on the facial aesthetic units are also different. That's why you see that basal cell carcinoma on the nose, while squamous cell carcinoma on the around of the cheeks. That's why when you go out in the sun, do you guys go to the beach? Do you guys go to the beach? Yes, no. You, yes, you do. What do you should put on your face and exposed part of the body?
Cover the face.
Sunscreen, beautiful sunscreen. What is in the sunscreen? What is in the sunscreen? The heavy metal which will protect the ultraviolet. Okay. Is there a beach in Riyadh? Bushra? Which beach did you go? Yesterday? Sarcasm. Sometimes, I came from Australia, full of beaches. Australia is a big island. Okay, the entire country is around. Okay, the border between the mainland and the sea. and the place where I used to live, the beach was maximum 4 minutes drive, 15 minutes walk. So every time you can have just a towel and a board short, off you go to the beach and come back without telling the wife. Okay. Otherwise you'll say, take me there, me and my son. Okay. Now lines, there are certain lines which you see, the cosmetic units and the junction lines of the face. There are different lines. Why we need to know these different lines? Because cosmetic surgeries, people will make different incisions along these different lines. You don't need to remember these, but just try to learn and understand. Okay. Now relaxed tension lines. So when we all get old, that's where some of these lines, like crow's feet. Do you see? Do I have crow's feet here? Yes, no. Do I have crow's feet? Better say no. Okay, because it's a sarcasm as well. Better say no. All good, clear skin. Yes, okay. I can see that. I don't have any wrinkles. I'm still young. We are still young. Okay. Let's carry on otherwise. But you see that we all will get old. With the aging face, the creases will start because of the atrophy of the underlying structures. So all these different lines that you see in different parts of the face, they are all because of the underlying connective tissue atrophy, the muscle atrophy. Hence you have these lines. Okay. You don't look a day over 20. Walid, I can offer you a coffee, but you have to prove it. All right, tell me what is happening here. Tell me what is happening here.
Beauty competition.
Miss Universe, beautiful. Which country?
Africa.
Which part of Africa? South Africa. Which year? 2019. Beautiful. This is Zuzebini Tunzi from South Africa. She has been crowned as a beauty. So beauty is in the eyes of beholder, isn't it? You see the beauty. But beauty industry of Saudi Arabia, look at that. Look at that. In 2024, it will be 5.5 billion US dollar industry. You can imagine how much you are spending and will be projected to spend. Should we take anti-aging supplements? There is an old person inside us. Should we take the agents? Now, one day we'll get old.
Optional, I think.
Optional. We can have an option. Option is for growing.
Yeah. But
Getting old is must. Getting up is optional. So let us get up and grow up. You know, that's what the people say. Getting old is must. Growing up is optional. So let's grow. This is what happens to the face. In young it looks triangular, in old it looks more rectangular. The structure of the face is skin, subcutaneous fat, muscles and the bones. Underlying subcutaneous fat, two layers, superficial and deep. You do not need to remember every other distribution area, but I just wanted to show you this is how it is distributed. Okay, distributed in our face. This is what you need to keep hydrated. This is what will give you the freshness of your face. Okay, the deep areas of the face, okay, which are sitting underneath, and these pockets are separated by different connective tissue compartments. That makes sense? This is what happens when they reduce in size, they atrophy, and that's how you see the difference in those areas where the deep fat reduces with the age. Now this is how sequence of the fat compartments deflation commonly observed in facial aging. So around the eyes, we look older around the eye. Do I look old around my eyes? I think you are saying no? Yes, yes. I heard it. I heard you say no. Now, with the age, skin, fat, muscle, bone, everything is receding. You can see the fat, you can see the muscle, you can see the bones. They are all receding. That's where the size of the face reduces with the age. Muscles of the face, put it together, we have constrictors and dilators. We have constrictors and dilators. Constrictors around the orbit, oral cavity and nasal cavity. We'll do it later, we'll learn it later. And dilators, okay? And there are many other additional muscles which are giving us facial expression. Okay, orbicularis oculi, three parts, orbital, palpebral and lacrimal part of it, and they arise from these different parts of different bones, from frontal bone, from maxilla, and from part of the ligament of the eye. So these are the different parts of the orbicularis oculi. Now if you look at the orbicularis oculi from inside, now here we are sitting from outside, now we are sitting inside. We are looking at the left orbicular oculi from inside or from behind. It is supplied by facial nerve. Okay, how do we test it? The blink reflex. So if you touch it, touch the cornea, we should blink. Okay, orbicular oculi act as a sphincter muscle of the eyelid. Okay, so normally what happens, the palpebral portion acts involuntary, closing the eyelids gently as we sleep or blink, but orbicularis, orbital portions, we can use forcefully. Like if you want to forcefully close your eyes when you see me out in the corridor, and if you want to avoid me, just do this. Okay, just close your eyes forcefully, otherwise I will see you. I'll see you in any ways. You will see me in your dreams even after the head and neck exam. Trust me, because you love me. Mouth, there are different muscles which are sitting around the oral cavity, but I want you to focus on Buccinator and Orbicularis oris muscle. There are muscles which are superficial and there are muscles which are sitting deep. Okay, so our Buccinator is sitting deep, so is our Orbicularis oculi muscle. They are sitting deep. These are the muscles which are sitting at the angles of the mouth. They will elevate the angles or depress the angle or make it wider. So these are different muscles. You don't need to remember every other small muscle. Buccinator. What this gentleman is trying to do? He's trying to impress the girl that he can play a instrument. What he's trying to do? Blow a trumpet. Okay, have you see that? Blowing a trumpet, having the air going out through force. Okay, so squeezing your air throughout your mouth is by, so it's a blowing. Okay, you compress your cheek, whistle, mastication. Okay, that's where the muscle is. It is arising from pterygomandibular raphe, and it blends with each other and blends with the other muscles. So you see that the Buccinator muscle fibers, they are blending with the muscles of the orbital cavity, and this is the same muscle which is helping us in neonate to suckle the milk. Okay, for the nursing, the mother's breast tissue, that will help us. Okay, I think it's the same muscle which will help us kiss as well. Yeah, I didn't put it, but I showed you what it can do. Orbicularis oculi, orbicularis, which is going around in orbits. But interestingly, they are not going round from point A to come back to the same point A. They are kind of half off. They are not circular. They are not. It's like a semi-orbit. Okay, but it's going around the orbiter. Okay, simple sphincter. But it's not a simple sphincter only. Okay, it's not a simple sphincter. It consists of numerous layers of the muscle fibers surrounding the muscle, arising from the maxilla and the mandible. So you see the upper fibers from the maxilla, the lower fiber from the mandible. Okay, and they go around and they are attached to they attach to the skin around our lips. Okay, facial nerve, closing and puckering of the lips. Okay, now this is the innervation of these two muscles that we talked about, orbicularis, oculi and oris. I will not go into the details now. We will talk about it when we talk about the facial nerve. Okay, I'll skip this, and I'll come back to scalp. That makes sense? If you have any question, stop me. If you have any question, talk to me.
No, doctor.
Neuro is not going to go anywhere, trust me. Neuro will stay. Neuro is going to stay. Shall we continue with the scalp? Yes? No question? Alright, Bushra, can you talk to us? You can unmute yourself.
Yes, doctor.
Tell me one interesting thing that you learned in last 1.5 hours. One interesting thing.
About the muscles, the Buccinator muscle and the Orbicularis oris.
Anything in last 1.5 hours, anything that you think, oh, this is something interesting.
The crow's feet. The crow's
Oh, okay.
thing.
Alright. The crow. So don't start looking everyone around the eyes. Then if you see the crow feet skin and you start calculating that, alright, this is 43 per age, this is 66. Oh, this seems to be 29, but this is older than that. Don't make these calculations. Very interesting. Anything else? Anyone else? Iman Ijaz, would you like to talk to us?
Good morning, doctor.
Morning. Would you like to tell us one thing that you didn't like in the last 1.5 hours?
I don't know, it was really interesting. There's a lot of new stuff. The fact that it's related to neuro, maybe not, but yeah, the rest of it is nice.
That's interesting. A lot of material. Interesting. A lot of material. Yes. But that's why you see that. Zaid, would you like to talk to us, please?
I think you didn't like listening to answers.
Ziad? Is Zaid or Ziad?
Yeah.
Ziad? Would you like to talk to us? Unmute yourself, sir. Ziad, are you there? Okay. Let's look at the scalp. Now, a scalp is an abbreviation of 5 different structures. Okay. Now, if you look at the extent of this scalp, it says from superciliary arches. Remember we talked about superciliary arches, which are as close to as your eyebrows, and it extends all the way posteriorly up to the superior nuchal lines. The word nuchal is referring to the neck. Okay, nuchal. So if it is a superior nuchal lines, means there will be an inferior nuchal line. Had there been just one nuchal line, we would have called it a nuchal line or the nuchal line. But we have two, superior and inferior. So from here to there. What about the side views? Now some textbooks and the surgery books will refer it that along the temporal lines. Remember that we talked about the temporal line. Some books will suggest that they are limited to the temporal lines only. Others will say, well, it's not only the temporal lines. They continue along the temporal area and go all the way to the zygomatic, all right, lines. But I personally feel like it's along the temporal lines. It's a good extension. So now you understand the extent of it. Now what are these different components? So we have the skin, we have the connective tissue from outside to inside. We have the skin, connective tissue, then we have the aponeurosis. If I say aponeurosis, what comes in your mind?
The muscle attachment.
The muscle. If I say a tendon, what should come in your mind? a muscle. What is the similarity between a tendon and an aponeurosis?
As the remnant.
Anyone from the chat room? Yes, it's the same tissue. It's the same tissue, but what is the structural difference? Both are connective tissue, agreed. Both have muscle. Beautiful. Alanud, would you like to talk to us? Talk to us, and it is free. I won't charge you.
Yes.
Yeah, tell us the difference between aponeurosis and a tendon.
Aponeurosis is more flatter.
Beautiful. Excellent. You're excellent. Aponeurosis is a flattened connective tissue structure attached to a muscle, at least at one end, while the tendon is a rounded connective tissue. We're having those regular connective tissue arrangement of the cells and the fibers, also attached to muscles, while the ligament is the similar structure of a tendon without any muscle attachment. These ligaments are attached to different bones. Okay, some other ligaments are also being labeled as neck ligament. Aponeurosis, I am not sure about the level of the toughness of the two, but there are structural differences only. Okay, so skin, connective tissue, aponeurosis, and pericranium. That's where you can see these different layers from outside to inside, from outside to inside till here. Now, as we talked about the muscle, what muscle are we talking about? We are talking about a muscle which starts from the front and it ends at the back. So at the front we have the frontal belly, and at the back we have the occipital belly. This muscle is called as occipitofrontalis. Occipital part is attached to the superior nuchal lines, while the frontal bellies are attached to the skin itself. That's why you can see, you can do this. Now when you do this, if I ask every one of you to put your hand at the back and do this, you see there is a muscle at the back also twitching. Okay, there's a muscle at the back which is also twitching there. We have 162 participants. How many of them are already gone and doing something else? 162 participants are there. Most of them are already gone. Frontal belly is attached to what? The frontal belly is attached to the skin. The frontal belly is attached to the skin. Now you can see that the aponeurosis at the back is attached to the muscle. At the front is attached to the skin. And remember this, it will have tension headaches are the, the muscle will go in a spasm and something like that. Okay, now let's look at some of the importance of these different layers. Now something which is called surgical layers: skin, connective tissue layer, and aponeurotic layer. These three upper layers, they act as one unit. So put your hand on your head and move the skin of the head. Can you move the skin on your head? Now what is moving? What is moving are these three layers together. They are three layers together. If they are moving on the bone, means there is some connective tissue between these three layers and the pericranium. Hence, the fourth layer, which is the loose areolar connective tissue. And this loose connective tissue is the layer when the skin is peeled off in road-traffic accidents of our surgeries. These three layers would be separated at the connective tissue layer. So this is kind of a plane of cleavage. Okay, head is caught in accident, that's where the skin flap will go. It will open up in the connective tissue layer. That makes sense? That makes sense? All right, I'll repeat myself and just wait. All right, let's look at this one. Now you see that 1, 2, 3 layers: skin, connective tissue and aponeurotic layer. These three layers act together. This is that loose connective tissue and this is the pericranium. When you are moving your skin, you are moving these three layers on this connective tissue because this pericranium is fixed. When these three layers go off, they go as one unit. These three layers will go as one unit. You cannot separate the skin from the underlying aponeurosis because the connective tissue, which is this connective tissue, which is a dense connective tissue, is holding these three layers very tightly together. That makes sense? Is it making sense? Bushra, is it making sense? Because you asked me to repeat myself. And this is the layer where the surgeons will do surgeries. For instance, if they have to need to fix certain parts of the, which three layers? The top three layers: skin, connective tissue and aponeurosis. These three layers act as one unit. Correct. And aponeurosis is fixed. Oh, sorry, the pericranium is fixed. So this is the loose connective tissue. That makes sense? Now if there is bleeding in the connective tissue, where it would go? Can it go backward? Can it come forward? Remember that this aponeurosis, this aponeurosis is fixed with a bone at the back, but this aponeurosis is attached to the skin at the front. So this connective tissue there can still continue forward, inferior to our eyebrows. Now backward, let's see it. Backward, you see that they are attached there. So if the aponeurosis is attached, so means the underlying connective tissue will be sealed off. But at the front, this is attached to the skin, means the underlying connective tissue will then continue around our orbit. That makes sense? That makes sense? Okay, now let's look at this wound. Can you see this wound here? Okay. Now tell me, would this wound will gap? Means would it increase in size?
Yeah, because the muscle is sitting.
Excellent. If you look at the direction of the muscle fibers, they are going from front to back like this. So if there is a wound there, the two bellies, the frontal bellies will pull it forward. The occipital bellies will pull the aponeurosis backward. So this wound, if it is deep enough, to cut the aponeurosis, the wound will gap. If it is only the laceration in the skin and the connective tissue, it will be limited there. That makes sense? Now you remember that we sweat a lot during summer from our head. It means there is a lot of blood supply to our head to keep our head cool. That's why it is important to keep the head cool. Keep the head cool. Now for that, if we start sweating, good blood supply. Good blood supply is good for functioning. But if it is a laceration, then it can bleed as well. Now the blood supply to the scalp is coming from all directions. So if you cut a vessel, it will bleed from both ends because it is coming from all the sides. Does that make sense? So they will bleed profusely, but they will heal quickly as well. Anastomose. If you stitch it back, they will heal back. Now this is Razaika. You see that if I have these fingers like blood vessels, they are coming from the front, from the back, from the side. They are anastomosing. So if you cut a vessel, it will start bleeding from both ends. It will start bleeding from both ends because they are coming from all directions. Okay? That's why the scalp wounds will bleed a lot but heal quickly as well. Does that make sense? Does it make sense, Razaika? Now let's look at this. Is a sebaceous cyst which is present in the skin. Blockade of the sebaceous glands secretions, that's where the cyst. Now let's look at these blood vessels. Remember that temporal vessels, these are the terminal branches of the external carotid. This is the facial artery. Now they are supplying the area of the face. So we are putting the face and the scalp together. So facial artery is artery which is supplying the face. It will also supply the nose. Okay. This artery is not running straight. It is tortuous. Tortuous means going squiggly, not a straight line like that. Why not? If we would have a straight vessel, I would not have been able to talk. I would have been blocked like that. But as I need to talk, open my mouth to put food in or yawn. If I need to yawn, I need to have an extra room of the vessel. That's why you see this facial artery there. At this point, when it is crossing the mandible, you can feel its pulsation. Put your hand there on the mandible. You should be able to feel the pulse there. One of your colleagues sitting here say, "Oh yeah." She said, "Oh yeah." Same thing with your superficial temporal. Okay. Now you see that the part of the face is also supplied by the terminal branches of the internal carotid. You remember we talked about the supraorbital and supratrochlear. These are the terminal branches from the ophthalmic artery, which is a branch from the internal carotid. Beautiful. Now you see that these vessels are going towards the vertex, which is the top. The vertex is the very top of your head. Look at these arteries, which are coming from the side: superficial temporal vein and artery, supratrochlear, supraorbital, and occipital, and posterior auricular. All these are going towards the top. Now you see that they are anastomosed with each other. That's why they help keep our head cool. And if there is a damage, they'll bleed, but they can help us. Venous drainage is the similar way that it drains. But look at this communication here. That's where the facial vein is. And now you can see that the angular artery and the vein there is communicated with the supratrochlear artery and the vein. Supraorbital artery and the vein there is a communication. Okay. This is a vessel which is running transversely in the face. We call it the transverse facial artery and the vein. Ultimately, they will drain into internal jugular vein, and a part will drain into external jugular vein. That makes sense? I would want you to look at this area carefully. Look at this area carefully, which is this area. Why do I want you to look at this area carefully? Because this is the area which is squeezing this area can kill. Why? Because if you have pimples, don't worry about it. It's one of the signs of the puberty, where different hormones in different individuals can have a lot of these pimples. If you squeeze a pimple and if it gets infected, where would the infection go then? It can go to different parts of the body which you don't expect the infection to go to. That's why this area of the face is called as the dangerous area of the face, or danger area of the face. Why? Because if you see this area, there is a vein which is a deep facial vein, and this deep facial vein is connected to pterygoid venous plexus. Remember we talked about infratemporal fossa? From there, the infratemporal fossa will have this venous plexus. From there, these communication, which are emissary veins. The word emissary comes from, do you know what is the emissary? Yeah, what is the meaning of the word emissary? Emissary. Your counselors. Different countries will have counselors and commissioner. Emissaries. So, Kingdom of the Saudi Arabia will have emissary in, for instance, in United States. They will have their high commissioner there. Those are emissaries because they belong to this part of the world and communicating whatever of the kingdom to Americans. Americans will similarly will have emissaries here. So they are kind of a communication. Okay. Not emission. Emissary is the communication. Okay. Now you see that once from the pterygoid plexus they can go inside and will communicate with the cavernous sinus. Now you can imagine the infection which was at the nose can spread to the cavernous sinus. Cavernous sinus is draining into cavernous sinus is in the meninges. So you can see that the infection will then travel into meninges. Also from the superior ophthalmic vein, it drains into cavernous sinus. So you see that this area of the face is pretty delicate area of the face in terms of its venous communication. Now let's look at this diagram and learn some other communications. Imaginary veins, from the outside they can communicate to the inside dural venous sinuses. Once again, the neuro. I love when I bring it neuro. Trust me, in my talk on the facial nerve and trigeminal nerve, there will be good relationship with the neuro, and you can relate it with your final effector organ supply. So you see that these veins, now if there is an infection there in the skin, it can easily trickle into the venous sinus. Okay, now these are those veins, cerebral veins, which are also opening into these sinuses. Okay, now this is something that we were talking about before. Remember, 1, 2, 3 layers. 1, 2, 3 layers. You remember we talked about the third layer is the aponeurotic layer, which is a green layer here. We have a muscle and a muscle, the frontal belly and the occipital belly. You see the occipital belly is attached to the bone there. Can you see that? Can you see that? Can you see the occipital belly is attached to the bone? Now there is a problem. Okay, this is the dangerous area, which is the subcutaneous, the subaponeurotic, which is the loose connective tissue area there. If there is bleeding, if there is a bleeding in this area, would it be able to trickle further down there?
No, it's
Because it is sealed off, it should not. But then it will trickle forward, because this is attached to the skin layer. So underneath that it will continue further down. It will continue further down underneath the orbicularis ocular muscle. You see that? So orbicularis ocular muscle there. So it will then spread between the tarsal plate and the muscle. Okay, it will spread in there. That makes sense? Hence you see this eye, which is called the black eye.
how can you differentiate between raccoon eye and black eye?
What's your name?
Mona.
Mona has asked another $1 million question. How would you differentiate between a raccoon eye and a black eye? Raccoon eye is present in both eyes, I guess, and you're correct.
Yeah.
Correct? Both eyes versus single, correct? Anything else?
Maybe colors, maybe it can be differentiated.
This can be present in one side, yes, we learned about it. It will be one-sided, yes. Direct blow on the eye can lead to the black eye. In the raccoon eyes, the bleeding is deep to the tarsal bone, the tarsal plate of the upper eyelid itself. Okay? So the tarsal plates, so eyelids on the top will be spared, so the bleeding will go around it. While in the black eye, the bleeding is superior to the tarsal plates. Okay? Now our eyelids, you will learn, maybe you will learn later when you learn about the eye, upper and lower eyelids have tarsal plates, which are making the upper and the lower eyelids, upper eyelid kind of firm. Okay, so look at this tarsal plate there. The bleeding is taking place there, where the raccoon eye bleeding is usually underneath this part. So hence it is spare the tarsal area. And obviously the other symptoms. Obviously you have a history of the fight as well. You know, when do you see these black eyes? Which age group you see these black eyes are common? Very interesting. School age, high school age. Which gender? Females. Okay. The other types of hematoma that you can see between different layers, I will not go into the detail. They are self-explanatory, that between the different layers there could be bleeding. All right. sensory supply, both of the scalp and the area of the face. We will learn about it when we learn about the trigeminal nerve. The terminal branches of the trigeminal nerve would supply the area of the scalp and the face through ophthalmic division, maxillary division, and mandibular division. These are the branches from the cervical nerves which are supplying the different areas. Okay, so we have occipital nerves, we have cervical nerves which are supplying posterior to the vertex. Anterior to the vertex we have these branches from supraorbital and supratrochlear, and that's how the motor supply through the facial nerve. Okay, motor supply, we will learn about the motor supply as we talked before. This is the important muscle, we call it as occipitofrontalis, and its innervation comes from the facial nerve. And I stop here. If you have any question, please shoot. You still have 2 minutes. I'll give you 2 minutes. If you have any questions for me, please let me know.
Doctor, about the bleeding, the black.
Sorry?
Could you go over the black eye again? Is the bleeding taking place? If you can show us in the diagram or the drawing.
Yeah, that's where it is. You see that the bleeding in case of the black eye is taking place deep to this aponeurotic layer. So between the aponeurotic layer, which is green, and the epicranium. So this loose connective tissue which continues down between the orbicularis oculi muscle and the upper eyelid tarsal plate. So it is going in there. That's why you see the whole thing looks blackish. That makes sense? Otherwise, this part of the upper eyelid would have spared if it would have been a raccoon eye. Raccoon eyes are usually bilateral, so the bleeding will spread because this is taking place below the base of the skull. There is nothing which is limiting it, so the space. But in case of unilateral spread of the black eye, it will go on one side. It can go on bilaterally, now it doesn't stop it, but usually it's one-sided.
It can be both sides.
It can be both sides. Yeah, it can be. It's not that black eye has to be one-sided, but usually seen on one side because usually blows are on one side, not right in the middle. So you don't measure it where to hit somebody right in the middle.
Yeah, and also it can be both sides, the raccoon and the black eye.
Doctor, on this slide is the trauma around the site of the occipital belly for the black eye. No, this is the frontal belly. It is just showing the trickling of the blood. Okay, it's showing the bleeding in this space.
So, sir, the bleeding, can we say the bleeding is in the loose connective tissue?
Yeah, this is where it is. That is absolutely right. The bleeding is in the loose connective tissue. Having said that, it doesn't mean that, for instance, if these three layers would have been lacerated and the bleeding will come inside and it can still trickle down there. Okay? But in that case, the bleeding will also go outside because it is an open wound. That's why when you hit someone on the head, there is no external bleeding, there is some swelling, and then after like 6 hours, there is a black eye. It can show underneath that, but you see this area of the skin, you remember we talked about this area of the skin is very thick. That's why. Do you have a lecture now?
Yes, we do have no, we have a meeting.
You have a meeting? I'm sorry. We need to stop.
Okay.
Thank you.
You're welcome.
We need to stop, all right?